Lecture 3, Preventing Abuse and Maintaining Respect. Hello, and welcome to the next module of the course. In this lecture, we're going to talk about elder abuse, including its types, signs, and consequences. We will also go through risk factors and important warning signs in carers' behavior. As we mentioned in the previous lectures, caring is a very demanding role. It puts the carer in a vulnerable position and can lead to a care burden. If the burden is not prevented on time, it might impact the carer's behavior and result in domestic violence. It is a sensitive topic, but a very important one, so we dedicated the entire module to talk about it. Violence against older persons is a global issue that is usually overlooked. Data on the prevalence of violence against the elderly is insufficient and underreported, as the issue is commonly perceived as a taboo. According to the World Health Organization, around 1 in 6 people who are 60 years and older have experienced some form of abuse in community settings during the past year. However, the World Health Organization assumes that these figures may reflect only a small number, and some experts believe elder abuse is underreported by as much as 80%. In 1995, Action on Elder Abuse proposed a definition of elder abuse, which became the most commonly used one. It was developed further by the World Health Organization in 2002 and is used as an umbrella term for the wide range of harm inflicted to older people. According to it, elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. Types of elder abuse. Now we are going to discuss each type of abuse in detail and give a description of certain signs which can indicate whether an older person is experiencing this type of abuse. The first type of elder abuse we are going to address is physical violence. It is defined as the use of physical force against an older person, which can cause bodily harm, permanent impairment, or physical pain. This may include scratching, biting, slapping, burning, throwing things at a person, using weapons or other objects to inflict pain, pushing, kicking, choking or strangling, force-feeding or denying food, and physically restraining a person. Certain signs can indicate that an older person might be experiencing physical violence. For example, injuries in different stages of healing, bruises, wounds, abrasions, contusions, broken bones, or dislocations of joints, decreased hearing, sight, or new dental problems, weight or hair loss, poor hygiene, oversedation, reduced physical or mental activity, grogginess, or confusion. Make sure to pay attention to the older person's behavior, especially if they seem to be cringing, acting fearful, or demonstrate unexplained anger when they are around the carer or relative. The behavior of the person's carer or relative is also essential. If the carer is overly protective or controlling, tells conflicting stories, and does not want to leave the older person alone, it may be a sign of abusive behavior from their side. The next type of abuse that we distinguish is believed to be the most common one. It is psychological or emotional violence. It is defined as systematic, non-physical actions which are intended to inflict mental pain, anguish, and suffering on an older person. Examples of this behavior include humiliation, for example, insults, scolding, verbal intimidation, and shouting, threatening, for instance, to threaten with physical punishment or delaying provision of food, isolating, for example, not allowing to see family members or friends, or controlling, for example, prohibiting or limiting access to transportation, telephone, money, or other resources. As psychological violence does not leave any visible marks, it is hard to prove or identify. However, paying attention to the older person's behavior, especially around the potential abuser, can be very helpful. Signs of psychological violence include feelings of helplessness, shame, and powerlessness, depression, withdrawal, apathy, loss of interest in self or environment, passivity, reluctance to make decisions, lack of eye contact with other people, unusual nervousness, anger, or paranoid behavior, and display signs of trauma, for example, rocking back and forth. Similar to cases of other types of abuse, it is crucial to pay attention to the behavior of the potential perpetrator. If an older person's caregiver or relative tries to isolate the elderly person and seems to be aggressive or overly controlling, it might hint at abusive relationships. The next type of abuse is financial violence or exploitation. It is defined as illegal or improper exploitation or use of funds or other resources of the older person. For example, controlling the use of money and property that belongs to the older person, theft, or use of coercion or fraud to obtain an older person's money or possessions. Signs of financial abuse may include numerous unpaid bills or overdue rent that an older person should be able to afford, a recently signed will or changes in a will when an older person is incapable of drafting or signing it, loans or mortgages obtained by an older person, missing furniture, jewelry, credit cards, or other items. Financial violence against older people can also be accompanied by emotional abuse, for example, threats or intimidation. Therefore, financial exploitation can result in causing fear, lack of trust, and anxiety in an older person's life. The next type of violence is sexual abuse or abusive sexual contact. It is any kind of non-consensual sexual interaction, physical or verbal, with an older person. It is believed to be the least reported type of violence against older persons. This type of abuse is believed to be experienced primarily by younger women. However, they are almost as universal among all age groups. There are many physical signs that can help to identify the victim of sexual abuse, which are relevant for the elderly as well. These include unexplained bruising, internal injuries, human bite marks, scratches, bruises, especially if they are on the face, neck, chest, and genitals, choke marks on the throat, mouth or genitals bleeding, unexplained venereal disease, urinary tract infections, anxiety, depression, or withdrawal and fear of being touched. Sexual violence can have a devastating impact on older women, causing long-term suffering. Some of the consequences include fear and unwillingness to live at home, inability to sleep at night, for example, having nightmares or flashbacks, severe psychological trauma, feelings of shame, guilt, and self-blame. Out of all traumatic experiences, sexual assault in adulthood is believed to be the most stressful one, and it takes time to recover from the trauma. Any unusual shifts in the older person's behavior or their caregiver or relative are also essential to pay attention to, as they could also be the signs of possible violence. The last classified type of abuse we are going to address today is neglect of care and assistance. Neglect can be defined as a failure by responsible persons to satisfy essential basic needs of an older person, such as medical attention or necessary medication, food, hydration, hygiene, and other basic daily activities, safety, clothing, etc., which results in severe health and safety risks. Neglect could be unintentional when a carer does not have the skills and knowledge that they need, or intentional when actions to harm the older person are done on purpose. This is an important distinction to consider. Neglect can take different forms, such as the inadequate provision of food and drink, or isolation, which results in a lack of mental, physical, and social contacts. Please keep in mind that the behavior of caregivers can change once someone else is in the room. Furthermore, certain signs can help to identify this type of abusive behavior. They include pain, discomfort, multiple large bed sores, unexpected weight loss, malnutrition, dehydration, constipation, poor hygiene, unkempt appearance, an older person or their clothes are dirty or smell strongly of urine, the person is left alone or unattended for a long time, and suffers from hypothermia or overheating. There is another subtype related to emotional violence and neglect, which is defined as communication neglect. Unlike other forms of neglect, in this case, daily needs of older people are met, but the necessary communication is absent. For instance, informal carers may avoid or ignore older adults' needs for relationships or social interactions. By reducing or keeping the conversation to its minimum, informal carers may leave older adults feeling isolated. Violence and neglect have emotional and physical effects on older people. When someone they trust is hurting or taking advantage of them, the older person may feel guilty, shocked, embarrassed, or ashamed. Sometimes, older adults may feel they must help and keep their spouse or children safe, even if they are violent or abusive. The older generation also may not think about the consequences or effects of violence on themselves. Isolation is the most significant factor contributing to the vulnerability of older people. Isolated, more aged people are left without access to information or services and placed at heightened risk of violence. Violence against carers. The aging process can also bring new behavioral changes in an older adult. Some informal carers report sudden behavioral changes in care recipients or relatives. An older person can become mentally or physically violent towards an informal carer because of diseases impacting cognitive capacities, such as dementia. Often, informal carers report missing the person who was there before the diagnosis. Some relatives report that people with dementia repeatedly insult them. It also happens that an older person physically hits a carer at night when he is in a delirious mode. Individuals can physically attack their informal carers daily. It can be difficult for an informal carer to cope with this. In many cases, informal carers report that they may overhear the insults but cannot tolerate physical violence. In case the older adult has not been diagnosed with dementia, it is recommended that they are taken to a personal doctor who will do a test for dementia or another disease. The carer can also manage violence by identifying the factors that trigger violent behavior in the care recipient and trying to anticipate them. Personality changes can be very pronounced in people with dementia. They can suddenly become upset or even violent in contact with strangers, in tasks that they cannot cope with, or in the face of rapid environmental changes. Relatives need to be alert of possible outbreaks of violence in a person with dementia. We can prevent unpleasant and difficult situations with the communication technique of diverting the patient with dementia elsewhere. By diverting attention, for example, to another task or conversational topic, we can prevent a sudden outburst of emotions. There is also an important distinction between agitation and violence. Agitation usually manifests as a psychomotor and verbal hyperactivity with insults, threats, screaming, and sometimes physical violence. It can range from mild restlessness to extreme agitation with senseless psychomotor actions. There is a high risk that in a state of aggression, a person with dementia will be physically aggressive and injure themselves or the care or medical staff. Although the boundaries are often unclear, an agitated person should not be mistaken for a violent patient. The violence that is not the result of a medical condition is handled legally, and the agitated patient needs to be treated by the medical staff. Warning signs and risk factors. Earlier, we mentioned possible signs of violent relationships that can be found in the behavior of the elderly person. However, there are some warning signs on the side of the carer as well. Those signs mostly indicate burnout, which is connected to a higher risk of violence within caregiving relationships. In terms of physical warning signs, the most frequent are the following: exhaustion, sore back and neck, insomnia, headaches, increased susceptibility to illness, hypochondria, irritable bowel, gastrointestinal distress, rashes, skin breakouts, grinding teeth at night, and heart palpitations. We also need to pay attention to a carer's increased use of alcohol and drugs, avoidance of the recipient, compromised care for the older person, lack of entertainment, avoiding friends and family gatherings at social events, impaired ability to make decisions, problems in personal relationships, difficulties with sex and intimacy, impaired appetite or binge eating, and thinking of resigning from a job. On a psychological level, the challenges of the caregiving role can have adverse effects on self-image related to caregiving stress, helplessness, and blaming oneself. These negative emotions can be a significant source of depressive symptomatology and carer burden, leading to an increased risk of becoming violent against older people. Other warning signs are related to the carer's cognitive functions, as there are carers who face difficulties in concentrating on specific tasks. They also might feel discouraged about the world and the future, feel hopeless, and have intrusive imagery. Furthermore, both high caregiving extent and low social resources are associated with low levels of life satisfaction. According to research, low life satisfaction can lead to potentially harmful care behavior, which may be considered an early warning sign of elder abuse or neglect. Domestic violence support. When helping older victims, their safety must always be a priority. Intervention should not worsen the situation. However, if the situation is life-threatening, professionals must take action immediately to protect the victim. It is essential to remember that mentally competent older people have the right to make choices that may seem thoughtless or harmful to others. Such decisions do not imply that the older person lacks mental capacity. All interventions must focus on the client's needs, even if the abuse is unintentional or the client is an abuser. Different aspects of the client's situation must be analysed and addressed. Professionals must respect older people's right to confidentiality. However, in case of life-threatening situations, it should not be a barrier to taking action. Confidentiality must be balanced against the possible consequences of inaction and the potential risks. Professionals cannot use confidentiality to justify the failure to address the abuse. If the older person discloses an abusive situation that happened to them, the professionals should try to gather as much information as possible. It will help to obtain an overview of what had happened. It is important to establish who was the perpetrator, how and when did it happen, and if the abusive situation happened again. There are some additional questions that can be used, including: has the older person looked for help? If yes, what happened? Does the older person have someone they trust and can contact if the abusive situation reoccurs? How does the older person see the situation? Do they want help in addressing it? If yes, what kind of help do they require? What would make them feel safer in the current situation? We can also recommend using a screening tool that has been developed to help identify if an elderly person is at risk of abuse. The Risk on Elder Abuse and Mistreatment Instrument, RIAMI, is a validated screening instrument which can be used by professionals who know an older person, their family, and social environment. The RIAMI considers both signs of elder abuse, such as suspicious bruises, and risk factors for abuse, such as the relationship between an older person and a possible perpetrator, as well as the physical and social environments of older people. The RIAMI is a short but thorough tool, which makes it possible to accurately assess the situation under time constraints. The unique feature of the RIAMI is that it takes into account different types of possible perpetrators, who are referred to as key figures. A key figure is close to an older person and usually has some sort of bond with them. This could be an older person's partner, one of the children, a neighbor, or a professional caregiver. The RIAMI questionnaire is filled in by professionals who are asked to what extent they feel the proposed 22 statements apply to their client. The response options range from completely disagree to completely agree. The 22 statements were developed based on the literature, results of previous studies, and 3 rounds of consultations with academics, healthcare professionals, and professionals who deal with elder abuse daily. You can find the RIAMI template attached to this week's course material. How to help a person with Alzheimer's or dementia. Coping with a chronic illness is not easy. Living with dementia changes not only the lives of those diagnosed with dementia, but also the lives of their family members. We can help a person with dementia by making a personal plan with them. It can be a document that covers the goals and wishes of the diagnosed person. For example, we want to find the answer to the question, what do they want to experience? A personal plan can also be a tool for planning personal care services. It is a good starting point for a conversation between family members about dementia and their expectations, dilemmas, and distresses. According to scholars, people with dementia usually wish for the following: basic diagnosis, understanding the course of the disease itself and some insight into how they can continue with their life, professional psychological support, compassion, hope, the right to be included in society, destigmatizing the knowledge other people have about dementia, other people to understand that a person with dementia had a non-dementia related life before the disease, music, photos of memories, and self-care needs. This is it for today's lecture. Thank you for watching. In the next lecture, we will introduce a good solution on how to eliminate informal carer's burden. It is a special workshop called Listen to My Story. So please make sure to complete the assignments for this module to move on to the next one and learn more about the workshop. Thank you and goodbye.